Hi, my name is Diya Singh and I'm from ME221. Today I'm going to be providing a quick book review on the Apley's and Solomon's Concise System of Orthopaedics and Trauma. Firstly, you can access this book via the IMU Library e-portal. Just search up for the ProQuest eBook Central Database and subsequently search for this book. So this book is the 5th edition. It is edited by David Warwick, Ashley Blom and Michael Whitehouse and published by the Taylor and Francis Group in 2021. So as you can see in the main page, you can choose to read the book online, you can download the book or just download specific chapters. Here there's a description providing a brief summary on what the book is about, as well as a table of contents page so you can see what it has. At the side here, you can also cite the book with the different formats such as the APA, the MLA, the Vancouver. Just copy and paste it into your research paper. So when you choose to read online, this is what comes up on the left-hand side. You've got the different table of contents and even a search bar. If you click the toggle, it opens up to the subsections of it. So this book is divided into 3 main sections. Section 1 is general orthopedics, dealing with common diagnoses, common issues that you might see, such as infections, osteoarthritis, different tumors, neoplasms, etc. Section 2 is regional orthopedics, so disorders according to the different limbs. So we've got the elbow, the shoulder, the wrist, the hip, knee, ankle, and foot. And the last section is trauma, dealing with different injuries such as fractures or dislocations and more. I like that this book has an abbreviations page pertaining to very common acronyms you see when studying sports medicine or even orthopedics. Things like ACL, dealing with the anterior cruciate ligament, and more. So it's good that they have this so we can understand what the text is actually referring to. So for example, in section 1, if I click on osteoarthritis, you can see that there are topics within that. So we've got the introduction, the prevalence of it, the epidemiology, the etiology, the pathology and pathophysiology, different outcomes of it, the assessment and management. So just scrolling down, you can see that they've got these little tables to provide a very quick summary on what they're actually looking for. So here you can see the pathology of it, different images dealing with the x-rays or different biopsies that you see, and they've got a little section here telling you what you're looking at, which I think is quite useful. So as a whole, this book is pretty good in dealing with, in providing information for clinical situations as well. So you can see here the signs and symptoms. So when we're doing our history taking, we can see that the chief complaint might be joint stiffness or pain, and then you can take your history of presenting illness, etc. And just looking through it, it provides very concise and very vital pieces of information are included in this book to be utilized in real-life clinical situations, as well as supplementing our knowledge for our examinations. As a whole, I think this book has a ton of information that can be used as an adjunct for exam prep, revision, or even clinical situations. So I personally believe that any course in IMU involving the study of MSK or just general topics of the limbs can utilize this book for their learning. I personally am from medicine, and this book really helps me picture the disease, form the differential diagnoses, and know exactly what to ask the patient when taking a detailed history, whether I'm in a hospital for a posting or when I'm just prepping for my OSCEs. I think it'll also help in studying for the CAs and FPPs, especially for the MSK modules in semester 4. So this book comes highly recommended as an additional revision source for your studying. So that's all. Thank you.